If you are over 60 and you have ever wondered what daily masturbation is actually doing to your prostate, you are not strange, you are not alone, and you are certainly not broken for asking this question. I've been a practicing urologist in the United States for decades, and I can tell you with full honesty that this is one of the most common private questions older men carry silently for years. Most men never ask it out loud. They just worry in the background. They notice changes in urination, pressure in the pelvis, night trips to the bathroom, weaker flow, discomfort after ejaculation, or sometimes nothing at all, and they wonder whether their daily habit is helping them, hurting them, or quietly setting them up for problems later. Today, we are going to talk about this calmly, clearly, without shame, without exaggeration, and without fear tactics, so you can finally understand what is actually happening inside your body and your prostate when ejaculation becomes a daily routine after the age of 60. First, let's clear something up right away, because confusion here causes unnecessary anxiety. Masturbation itself is not a disease. It is not immoral from a medical standpoint, and it does not automatically damage the prostate. The prostate is a gland, not a moral judge. It responds to hormones, blood flow, inflammation, pressure, age-related changes, and lifestyle factors. When you ejaculate, whether through sex or masturbation, the prostate contracts and releases fluid that makes up part of semen. This is a normal physiological process. The question is not whether ejaculation happens, but how often, in what condition the prostate already is, and what else is happening in your body at the same time. Age changes the equation. What felt harmless at 30 or 40 does not always feel the same at 60 or 70, and that is where most men get confused. By the time a man reaches his 60s, the prostate has usually gone through decades of gradual enlargement. This is called benign prostatic hyperplasia, or BPH, and it affects the majority of men to some degree. The prostate tissue becomes thicker, less flexible, and more sensitive to pressure and inflammation. Blood circulation in the pelvic region is not as strong as it once was. Hormone levels, especially testosterone and dihydrotestosterone, shift in ways that change how prostate tissue behaves. Nerves become more sensitive in some areas and less responsive in others. This means that the prostate does not always respond to stimulation and contraction the same way it did earlier in life. When ejaculation becomes very frequent in this stage, the effects can vary widely depending on the individual. For some men, regular ejaculation can actually reduce congestion inside the prostate. Think of it like fluid movement. When prostatic fluid sits stagnant for long periods, it can contribute to discomfort, a feeling of fullness, or low-grade inflammation. In those men, occasional release may improve comfort and even reduce pelvic pressure. This is one reason why some older men report feeling relief after ejaculation. Their prostate was congested, and releasing fluid temporarily reduced that internal pressure. In medically selected cases, controlled ejaculation frequency has even been discussed as part of symptom management for chronic prostatitis-like discomfort, though this is never one-size-fits-all. However, daily ejaculation is not always neutral, and this is where honesty matters. In men over 60 who already have an enlarged prostate, daily stimulation and contraction can sometimes increase irritation rather than relieve it. Each ejaculation involves muscular contractions around the prostate and bladder neck. When these tissues are already thickened or inflamed, repeated stimulation can aggravate symptoms. This may show up as burning during urination, increased urgency, pressure behind the pubic bone, discomfort in the perineum, or a sense that the bladder never fully empties. Some men also notice that their urinary symptoms worsen the day after ejaculation rather than improve, and this is an important signal that frequency may be too high for their current prostate condition. There is also the question of inflammation. The prostate is particularly sensitive to inflammatory triggers after 60. Poor sleep, dehydration, alcohol, constipation, prolonged sitting, and stress all increase pelvic inflammation. When daily masturbation is added on top of these factors, the prostate may not have enough recovery time between contractions. This does not mean ejaculation is harmful by default, but it does mean that recovery matters. Just like muscles need rest, irritated prostate tissue benefits from periods of calm. Without that calm, chronic low-grade inflammation can quietly build, and inflammation is one of the key drivers behind worsening urinary symptoms over time. Another area men worry about is prostate cancer, so let's address that clearly and responsibly. There is no strong evidence that daily masturbation causes prostate cancer. Large observational studies have suggested that regular ejaculation earlier in life may be associated with a slightly lower risk of prostate cancer, possibly due to reduced exposure to carcinogenic secretions. However, this data is not specific to daily ejaculation after 60, and it does not mean more is always better. Cancer risk is influenced far more by genetics, age, inflammation, obesity, metabolic health, and hormone balance than by masturbation frequency alone. So if fear of cancer is driving your anxiety, daily masturbation is not the smoking gun many men secretly fear it is. What does matter deeply, though, is how ejaculation interacts with urinary function. The prostate sits directly below the bladder and wraps around the urethra. When it swells or becomes irritated, urine flow suffers. In some men, frequent ejaculation can temporarily increase prostate swelling due to increased blood flow to the area. This can make nighttime urination worse, weaken stream strength, or increase post-void dribbling. Men often don't connect these dots. They assume symptoms are just getting older, when in reality, timing patterns around ejaculation are offering clues about prostate tolerance. There is also a psychological component that deserves respect. Daily masturbation can sometimes become less about physical release and more about habit, stress relief, or sleep regulation. When ejaculation becomes the primary way to calm anxiety or induce sleep, the nervous system stays in a constant cycle of stimulation and release. In older men, this can dysregulate pelvic floor muscles, leading to tension rather than relaxation. A tight pelvic floor can worsen urinary symptoms and contribute to discomfort even when the prostate itself is not severely enlarged. This is why some men feel worse even though scans show only mild prostate changes. Hormonal response also changes with age. Ejaculation temporarily alters prolactin, dopamine, and oxytocin levels. In younger men, recovery is rapid. In older men, that hormonal rebound can be slower. Some men notice fatigue, low motivation, or mental fog when ejaculation is very frequent. This is not weakness, it is physiology responding to age. When energy recovery slows, the body often sends subtle signals asking for moderation. So what is the medically reasonable takeaway here? Daily masturbation after 60 is not automatically harmful, but it is not universally beneficial either. The prostate does not thrive on extremes. It thrives on balance, good circulation, hydration, reduced inflammation, and recovery time. Many men do best with a frequency that allows the prostate to fully settle between ejaculations. That frequency is different for each individual. Some men feel best with release every few days. Some tolerate more frequent activity without symptoms. The key is listening to patterns rather than following myths or internet extremes. If ejaculation leaves you feeling relaxed, comfortable, and symptom-free, your prostate is likely tolerating it well. If it leaves you with increased urgency, burning, pelvic pressure, or sleep disruption, your prostate is asking for less stimulation and more recovery. Ignoring those signals is how mild irritation turns into chronic discomfort over time. Lifestyle matters more than frequency alone. Hydration keeps prostatic fluid thinner and less irritating. Regular walking improves pelvic circulation. Limiting alcohol and spicy foods reduces inflammatory triggers. Managing constipation reduces pressure on the prostate. Good sleep allows tissue repair. When these foundations are in place, ejaculation is far less likely to cause problems. When they are missing, even moderate frequency can feel harmful. I want to say something very important to you now, especially if you've carried guilt or fear around this topic. Your worth as a man is not measured by how often you ejaculate or how often you don't. Your prostate is not judging you. Your body is simply responding to signals. Learning to interpret those signals is not weakness. It is self-respect. Aging does not mean giving up pleasure, but it does mean adjusting habits to match a changing body. If you are over 60 and dealing with urinary symptoms, pelvic discomfort, or anxiety around prostate health, the most powerful step you can take is not to obsess over one habit, but to observe your body honestly and make small, respectful adjustments. Prostate health is a long game. It is built over years, not days. Fear pushes men into extremes. Understanding pulls them back into balance. I've seen thousands of men sit in my office wishing they had listened to their body earlier, instead of assuming discomfort was inevitable. It isn't. Many prostate problems progress slowly and silently, but they also respond remarkably well to early awareness and gentle course correction. You do not need shame. You do not need fear. You need clarity, patience, and self-trust. So if this video helped you finally understand what daily masturbation may be doing to your prostate after 60, take a breath. You are not late. You are not damaged. You are simply learning. And learning is exactly how men stay healthy, independent, and confident well into their later years.